Hello guys, welcome to the fourth part of this lecture, which is the pressure in the skull. And just like we have some like a disease related to the pressure. For example, if you have the brain is continuous or contains approximately 150 centimeter cubic of cerebrospinal fluid. Okay, and this is generated with a series of interferences is called ventricles. Okay, the fourth one, the third one, the lateral one, all of them is a series of ventricles that are generated the fluid and pass it through the brain. Okay, cerebrospinal fluid is generated inside the brain and the flow through the ventricles. So it will be, for example, we have this fourth ventricle here. The it will be passed through it. We have this one as well, third, and so on. Okay, what's the problem? The problem is it just like when the spiritual is generated inside the brain and the flow through the ventricles into the spinal column and eventually into the circulatory system. So this is the ideal process. However, sometimes we have one of the ventricles which is named aqueduct. Where is the aqueduct? This one is the aqueduct, the small one. Okay, this one here. This one is named aqueduct. This one is specially narrow. Okay, if at birth this opening block for any reason, it will be is blocked. So this area here is blocked. When it's blocked, that means the cerebrospinal fluid will be not passing through the spinal cord. Okay, so the CSF is trapped inside the skull and increase the internal pressure. So the pressure will be what? Will be an increase in this area. Okay, so when it's increased, you will see that the skull will be enlarged, and this series condition called hydrocephalus or water-headed. Okay, water-headed or hydrocephalus is the an increasing of the pressure during because of the closing of the aqueduct ventricle. It can be often corrected by the surgical by using the drainage system for the CSF. So drainage system, they will open the aqueduct and it will be using it to make the things happen correctly. And this one is very common very common. It's happened to the infants. Why? Because their skull is softy, spongy. So it can be with using with the pressure, you can be go farther more bigger than when it's normal. While for adults, the skull is bone and bone cannot change during the pressure. So it will be happen mostly with the infants. The second types of disease we have it is named the eye pressure. The shape of the eye is maintained fluid pressure called intraocular pressure, which is normally between 12 and 24 millimeter mercury. So the pressure here to keep this eye on the shape of this shape, it will be in the range of 12 to 24 millimeter mercury. When the circulation of the fluid in the eye is blocked, okay, so this one here is blocked, it can lead to build up in the pressure. Okay, so when this area is closed, the circulation of the fluid, when the fluid is go out or go in, is blocked. So the pressure will be increased inside this area, lead to build up a pressure. A condition is named called the glaucoma. This disease is named glaucoma when the pressure on the eye it will be increased. Okay, the net pressure, the pressure will be become as great as 85 millimeter mercury, and an abnormal large pressure can be permanently damage the optic nerve. So this pressure will be pushed on the optic nerve damage, and then it will be cause for the we name it as a blindness. Okay, or we name it as well as a tunnel vision. The shape of the eye is maintained by the fluid pressure called intraocular pressure, as we said. So see, and then when you have a fluid more than is expected, it will be damage the optic nerve. So you will have you will be blindness and you cannot see anything. And this disease is named glaucoma. Okay, it will be named glaucoma. Okay. And I will explain this formula and these calculations in terms of you will find this one in the part 1, section 2. Okay, the last one is just like the treatment using the pressure. We have a hyperbaric oxygen therapy, which is a device using pressure with the 2 or 3 times bigger than bigger than the atmospheric pressure. We'll push it on the lungs to make the oxygen, make the treatment. And this treatment is for the gas gangrene patients, okay? And this one is just the bacillus that causes a gas gangrene cannot survive in the presence of oxygen, okay? That means all gas gangrene patients will be treated with the HOT, are cured without need to the amputation. So there is not cut for the legs because of the gangrene. So it will be like the pressure and the oxygen will be kill the bacteria, and then you'll be survived without any amputation. The CO poisoning is the same. So in the carbon dioxide monoxide poisoning, the RBC cannot carry oxygen to the tissue because of the CO. It just fast into the HP. Okay, at the places normally using oxygen. With the HO2, what will happen? The partial pressure of oxygen can be increased by a factor of 15. Okay, to make the oxygen will be dissolved to fill the body need. Okay, many victims of CO poisoning are saved with this technique. So they will using the pressure, we will push up, we'll get the CO2 outside and make the oxygen instead. So you can make it. And the third one and the last one is will be the for treatment of the cancer. HOT can be used in conjunction with the radiation in the treatment of the cancer. And this is the end of the lecture. Thank you very much, guys.